Thank you very much, Dr. Chen Chien-Jen, for a fascinating talk. My own quick observation is every individual action in your action list of early response, prudent, solidarity, sounds simple, but the whole package
That's right.
Rather complex. To get this done, I feel is a science issue, a science policy issue. But let me thank you again, and I open up the opportunities to colleagues to ask their questions in a moment. So please go into, preferably go into the chat box and write your questions. If you want to put up your hands. I see hands up from the previous talks. I see a hand signal from Martha McNutt. Martha, would you like to take the floor right away? And while I encourage others to get ready with their questions. Martha,
sure, I have a quick question. And that is, what is the role of culture in the ability of a country like Taiwan to control the pandemic so well? In other words, the belief that it is the responsibility of each citizen to protect every other citizen, as opposed to those countries where there is less of a tendency for people to take shame in having infected someone else by not wearing a mask?
Oh, this is a very good question. Basically, Taiwanese people learned a lot from the SARS outbreak in year 2003. At that time, we were severely affected. So people learned how to love each other and also help each other. And the government also amended our Communicable Control Act, and we restructured our Ministry of Health and also the Taiwan CDC, and we recruit more infectious disease physicians in our Taiwan CDC, and we also have a complete system for the mobilization of healthcare institution for the taking care of this emerging infectious disease patient. So we are not spontaneously have the culture to cope with the diseases. Basically, we learned from previous misery, and I consider that there's a H5N1 avian flu and also H1N1 pandemic flu. We also learned from that. So we learned gradually from our suffering previously. But and Taiwanese people now are much well prepared for this COVID-19.
Thank you.
There's a question from Jose Onuchek, who asks, could you comment on mechanisms for reopening after control of the virus? What level of virus transmission is acceptable in reopening? What is Taiwan's policy?
With regard to the reopening of the border, for the time being, we open our border for business trip and also for immigrant workers as well, but we're not open for tourism for the time being. And our policy is that for those who want to get into Taiwan, to have the test before their entry, and also after they arrive at Taiwan, they have to be home quarantined for at least five days, and then have a test. Otherwise, they have to be quarantined for 14 days. And nowadays, we have a lot of businessmen as well as migrant worker getting Taiwan now.
Okay. Wolf, you unmuted. Did you want the floor?
No, I'm fine.
Okay, that's good. William Phillips.
Yes, thank you. My question is related to the question that Marcia raised, and having to do with mask wearing. Today, we have, I think, a reasonably clear picture about the efficacy of masks, that they are quite modest in their effect as self-protection and quite effective in the protection for others against infection by the mask wearer. But at the beginning of the pandemic, that view was not at least very well understood throughout the society. In fact, we heard pronouncements by people saying, there's no sense in wearing a mask because unless you wear a very tightly fitted, professionally fitted N95 mask, you really don't get very much protection, with very little attention paid to the efficacy of the mask in protecting others. Now, what I'm wondering is, was that distinction about the relative protection of oneself compared to the protection of others, was that well understood from the beginning in China and in Taiwan and in other East Asian countries, where the culture of mask wearing seemed to be much more ingrained from the very beginning?
Yeah, mask wearing basically has a very good effect control that H1N1 pandemic in year 2009 to year 2010. So at that time, people already learned that wearing mask is good to prevent the spread of the virus to others and also can protect themselves. But at the beginning of this pandemic, we run short of face mask. That's the reason why we have to increase the face mask production. And from this January, it's only 1.8 million per day. And then we increased it to 21 million per day in May. So we have adequate face mask. But more importantly, we also have the face mask rationing. We want to assure that everyone in Taiwan may have this face mask at a very low price. So this kind of mass production and e-rationing are very important. So we have so-called name-based rationing of the face mask. And fortunately, Taiwan people already learned that face mask wearing is important.
Okay. Dr. Chen, I give you 3 more questioners. First, Takashi Gojobori from Japan, our academician, thanks you for the presentation and asks, could you tell us how Taiwanese scientists contributed to the successful anti-COVID-19 activities? Secondly, I give the floor to Maria Zuber.
Yes, thank you. That was an excellent presentation. I'd like to know in Taiwan, who are the most effective messengers? Is it public health officials, government officials, community leaders, and is there a partnership in trying to get consistent messages out to the public?
And third, I ask Andrew Kambugu from Uganda Infectious Disease Institute to take the floor. Andrew.
Thank you very much, Joachim, and the presenter for our engaging talk. A short comment and then a question. In Uganda, generally, we see that there's very low mask wearing, and I think the thinking is that because we haven't seen as much mortality, the perception of risk and getting severe disease is quite low. And I related this to your comment that Asia has gone through some other infectious disease crisis that has led to mask wearing, which I find very impressive. But could you also share some data around the gender dimensions of COVID-19? In Uganda, we're seeing severe infections predominantly in men, and that is the same for mortality. And it would be nice to hear your comment. Thank you.
Okay.
Back to you.
Okay, thank you very much. With regard to the questions of our Japanese colleagues, I think that in Taiwan, unfortunately, in our cabinet, I myself is an epidemiologist, and there's a vice and a premier is also a public health practitioner. And in Taiwan, we respect professionalism a lot. So we set up a so-called Central Epidemic Command Center. And among these command centers, all these commanders are public health professionals, or there's a clinical clinicians and basic scientists. And we also have an advisory board for this CECC. And CECC, since it's composed of the all scientists and also the professionals, so it easily to get the support and also get its authority, and then the people have the trust on them. And this just the answer to the second question. Yes, the major messages was announced by our Central Epidemic Command Center. We have a so-called daily press briefing every day. And they announce there's an outbreak information, and they also provide education materials and answer almost all the questions from the mass media. So they can distribute it, there's correct information, and to stop this disinformation dissemination. So I think that the major message basically is from our Central Epidemic Command Center. And with regard to this the agenda in Taiwan, since we have only around 500 cases, and more than 90% of them were imported cases, and most of them are immigrant workers. So there are a lot of them are young people, and also they are healthy people. That's maybe one of the reasons that we have much lower case fatality compared to other countries.
Thank you very much.